Welcome, everyone. Thank you so much for joining us today for our monthly Zoom about the amazing Lifewave products. And today I have, for the very first time, a new guest. You're going to really be thrilled because the information is fantastic. And Dame Lillian Walker is a neurosomatic practitioner. And in a moment, I'll tell you all about her. And I want to remind you, Lifewave has 100 patents for their stem cell restoration patches and other products because they work. And my guests are not prescribing or treating or diagnosing. They are telling you from their professional expertise what they have found to be the most wonderful and inspiring results of using Lifewave products for themselves, their patients or clients, and their families, and they're telling you exactly how you can do that. So do keep that in mind. And now let me tell you all about Dame Lillian Walker, because she is a remarkable guest who has so much expertise in brain health. So she's the creator of the PSMO method for resolving and dissolving anxiety and depression. She's the creator of NeuroHealth Reset and the neurosomatic process for pain relief. So, you know, those are my two big things. I want everyone to have brain health and complete pain relief. So all in one person, our guest today. She's a neurosomatic holistic practitioner. She has a PhD in integrative medicine, and we are off and rolling. Welcome, Lillian.
Hello, how are you doing, Susan?
So thrilled to have you here. Really, really excited. And the first question, because that's the theme of today's show, you have the Fantastic 5 patching plan. So we want you to tell us which patches, where do you recommend them, what are the results?
Okay, so I love the Fantastic 5, and that's what I call the stem cell activation patches that take care of the primary systems of the body. So as you may or may not be aware, for those who are new listeners, for those who are returning, of course, they're aware that the mother stem cell activation patch is the X39. That's our flagship product. That is the stem cell activation patch that actually turns on 1/3 of your previously dormant stem cells. It's like we flip this light switch the moment we put this little solar panel on our body, boom, 1/3 of our previously dormant stem cells come back to life and they're on. Prior to that, we had them all at conception. At conception, when our mother's ovum united with our father's sperm, we now had that complete information of 23,688 stem cells to form us in our mother's womb. And so that's the first of the 5 stem cell activation patches that I like to call the Fantastic 5, followed by X49, which does something entirely different from X39, because that patch is the patch that has to do with radiation protection from radiation poisoning. We're all bombarded every day with blue light toxicity from LED lights. And so that patch really helps with those things as well as cardiovascular function. And then we have the 3 master antioxidants, glutathione, carnosine, and eon. So that's what I call the Fantastic 5.
Thank you so much. And anyone who doesn't have the 2 different pages of the X39 versus the X49, just email me. I'll email them to you and I'll give you my email address later at the end of the show. That's fantastic. And so is there any information that's important about placement? And let's go right into the next question when you answer that, because the next question is how confusing most of us find meridian points if we're not trained in meridian points.
Okay, and this is a wonderful thing to talk about because this comes up all the time. And I try to simplify it. And even though no 2 bodies are alike, because our bodies and our chemistry are like thumbprints, where even identical twins don't share the exact same thumbprint. And so we have to put the patches on based on what's going to work for our body, even though we have recommended general points that come in the little booklets, right? So my rule of thumb is, obviously we have 90 independent scientific research studies that show the neck bump, technically known. See, you don't have to be perfect to do this. It's governing vessel 14, which is your neck bump, the base of your neck, the top of your spine, and or conception vessel 6. Now, separate from that, my rule of thumb is, if you're feeling pain, point to the pain and patch it. Easy peasy. Point to the pain and patch it. So for example, I had a lady named Carol who several months back found herself with having problems breathing, and she was having chest congestion, and she found herself, desperate for the breath. And so she ended up in the hospital. Luckily, she had her patches with her. And then I told her, if you're in the, because she reached out to me via text, she told me what her predicament was. And I said, just put them all on your chest. So she immediately took her patches, put them all on her chest. And within minutes, her chest congestion just basically resolved and dissolved in real time. And she said it just took a few minutes and she was let go from the hospital, was able to come home. And I've had many people who have had upper respiratory conditions. And I like to emphasize, none of our patches treat a condition, a disease, a diagnosis, whatever label you've had anyone give you about whatever it is that you're experiencing. None of these patches address those specific things. Our patches are general wellness products. They're FDA compliant Class 1 medical devices under the general wellness category. General means general, the entire body is taken care of. So wherever it is you feel pain, I had another gal had hip pain. The doctor said she needed her left hip to be replaced just like her right hip had been replaced 10 years before. And her name is Teresa. She just took the patches and she took my instruction, point to the pain and patch it. She basically had them all linked in a row and put them all across her hip. The very next day, she was able to get up out of her bed. Instead of on all fours, she was able to get into a squatting position, something she hadn't done in 10 years. She had the strength, the mobility, and flexibility to get up from a squatting position in just the first day after having put the patches on her hip instead of on her neck bump. And so she hasn't needed, now it's been like 8 or 9 months. So she's definitely not having the hip replacement surgery because she doesn't need it anymore because of the regeneration that took place.
That's so beautiful. And just to remind you guys, from the top of my head to the bottom of my feet, I have had miracles with localized patching. Because long before I heard about this from Dame Lillian or I heard about this from Marcy, it was common sense to me that if I was having acid reflux on my chest, that's where the patch needed to go. And in 5 minutes, the symptoms, pain, misery, suffering, fear, anxiety was gone. Then when it happened, same thing, but it was on my back, I put the patch on my back, and on and on. So if you want a page and a half of Susan Allen's miracles with localized, places, like email me and I'll send you that too. Because I said to myself at some point, Lillian, I've had all of these problems they're describing, nothing new here. Okay, next question. PTSD is so huge.
Yes.
And the accompanying depression and anxiety, it is an epidemic and it is endemic. Please talk to us about that.
So let me dispel one of the first myths about PTSD, because people think that PTSD is just this airy-fairy mental illness and that it's not something tangible that you can wrap your hands and fingers around. And what the average person doesn't know is that if you do a SPECT scan, we can actually see PTSD on a SPECT scan. So it is something that neurophysiologically alters the brain when you have a traumatic event that causes that PTSD. So that's the first thing I want to bring to people's awareness, that please honor and respect those things that you can't see that are going inside of people's bodies. Just like a traumatic brain injury, you can't see it because you might see someone speaking and talking and they may apparently be completely fine. and then you'll have something strange, either an errant word, or they will completely forget what they were talking about because they lost either short or mid or long-term memory, whatever the case might be. But PTSD is something tangible. We do see them on brain scans. So that's the first thing. The second thing is, I want you to think of the body in two parts. Even though our body is an entire organ, it's a collective of many organs inside of it. So your brain, you have your left and your right brain hemisphere, and the left lobe does not share information with the right lobe. So I want you to make this distinction that in the left brain, that's where anything that we've ever read, learned, experienced, anything that we've been exposed to, that is stored in the left side of the brain. So when you have a traumatic event, an accident, a divorce, maybe you had a terrible diagnosis that shocked you, or you lost someone unexpectedly, or after a long time of battling with, helping someone through an illness and treatments, then all of a sudden, the rug was pulled out from under you, and just as you thought they were getting better, they're gone. All those things can cause PTSD. Now, that memory, that experience that you, through your eyes, your ears, your visual, your auditory, your olfactory, gustatory, and kinesthetic, your skin sensation, experience that, you have a memory, and a fragment of that is put in the left lobe of your brain. And then below the neck, the shock that you felt when your car hit that other car and your body tensioned up, the energy from that impact, that's still in your body the day of that accident. Now I want you to think back when you were 2, 3, 4 years old, or think about a 2, 3, 4-year-old that you have around in your environment, or that you see out in public. And you will notice that children, for no apparent reason, will start to bounce on the balls of their feet. Their eyes will roll up into their head, and they will start to shake and go in circles, doing this motion, and then they'll stop. And we don't think anything about it. And as parents, we condition our parents that by the time they get to kindergarten or first grade to stop doing that because they look dumb. It's not a flattering thing. It's like picking your nose. Everybody does it. You just don't do it in public, right? But we don't know what we don't know until we know it. So we condition them not to do it ever, and they stop doing it. Pause button. Now look at your animals. Anybody who's ever had a cat or a dog, anybody who's witnessed ducks in a lake, you see animals like a cat will be walking through your house, and for no apparent reason, it'll shake head to toe. Same thing with your dog. All of a sudden, it'll shake. And we think, oh, there's probably a flea or a bug or something, an itch that they have. No, that is their autonomic nervous system that is shaking off from the meat suit some sort of energetic trauma that got lodged in their body. And they know instinctively, and we know instinctively, that you can't keep it. So you literally shake it off. So if you look at the first thing, I talked about how a child's eyes will roll up in their head. Our eyes, it's like between the breath and the eyes are like a lever, like an on-off switch for the brain. So when you take your eyes and you look above your eyebrows and you do this motion, that automatically brings your brain into theta state where you're not thinking about anything in particular. It's a great eye position to adopt for meditation. But in this particular case, again, children do it instinctively until we get it conditioned out of us. Next of all, you see that the child is like shaking, just like the animal shaking head to toe. That shaking out is literally releasing the energy from the body head to toe as they bounce on the balls of their feet, which is flushing out their lymphatic system. So you'll see elements of that and pieces of that in the PSMO. When you check out the PSMO method, you can just go to YouTube, put the PSMO, that stands for Physiological Size Maniocular Technique. And what you're doing as you do the PSMO is that you are literally wiping out, first with the breath, you're resetting your brain because the breath is the remote control to the brain, and you're sedating the part of your brain, the hippocampus in the back, which is your fight or flight response, and it sedates you. And then the second part is you have the maniocular technique, which is an offshoot, and if you want to call it a modification of EMDR, where you're literally wiping out memories like a dirty windshield, and now you're just cleaning it out. You're literally cleaning things out of the brain and resetting it. And the third part is the lymphatic flush. So then in less than 3 minutes, that PTSD, anxiety, negative looping thoughts, bad feelings that you're having in your head as well as your body, it's gone, resolved and dissolved, and you have a reset, and you're also energized.
Phenomenal. I mean, you are worth your weight in diamonds, and you don't weigh that much. So you get, normally it's gold, but for you, because you're, petite, and diamonds. Okay. Platinum, whatever. Emeralds are more valuable than diamonds. I'm upgrading it, right? That was incredible. So helpful. And I know that each of us who's watching, we have so many friends who need to know this. So please, this will be up on my YouTube channel in about 10 days. And you'll know from me if you're on my email list when it's live, and please share this. Incredible. Okay, next, neurological issues. Guillain-Barré, Parkinson's, MS, etc. You've had remarkable results. Please tell us about that.
So this is one of my passion points because after you see a certain number of people, you see recurring patterns and you start to see common denominators. And so one of the things that I learned fairly early on is that the brain responds in predictable ways. When the brain has something foreign in it, doesn't matter if it's a bullet, if it's a parasite, if it's a cyst, if it's a tumor, the brain is going to respond in a predictable manner, and you're going to have the manifestation of certain types of outcomes. So there's also, when it comes to neurological issues, our nervous system is designed to work in a particular pattern. And when you have a pattern interrupt, then it starts a domino effect where it knocks one thing over, and an individual might notice one symptom, but not enough to really freak them out or alert them or make them run to the hospital, right? It's not until you have one and another and another. And as you have this cascading effect where things just start to get, I hate to say it, but things are either green and growing or brown and rotting. So things can get infinitely worse or they can get infinitely better. And so since we're alive, it depends which way our health is going. Oftentimes people's health are going infinitely worse until they find us, and we can help them with the stem cell activation patches, right? So with neurological conditions, there are certain common denominators that I see. And again, we're not here to treat, heal, cure, or diagnose anything. I'm just sharing with you the experiences that I've had with people that have these type of neurological issues. So one of the big things with people with neurological conditions is, number one, they have a glutathione deficiency. Now, glutathione, you may or may not be aware of this, but glutathione that is taken as a supplement in oral form, you're just wasting your money because you have acids in your stomach that destroy that orally taken glutathione. So you take glutathione expecting your glutathione levels to show higher in your blood test, and you're not going to see that much of a benefit, if any at all, because the acids in your stomach are actually destroying the glutathione. And we know this because we've measured it and because we have scientific studies to evidence this. We do have the intravenous form of glutathione that you can do by shot or by IV, and that does work, but it only has a lifespan of 7 minutes in your bloodstream, and then the effects dissipate because it gets diluted in your bloodstream as your blood continues to circulate throughout your system. You do get a benefit, but you cannot even begin to compare, especially if you look at the research studies that we have on the glutathione patch. When you apply a glutathione patch for 12 hours, you're signaling that glutathione to be activated based on whatever your original playbook was in your mother's womb. And now a third of whatever your previously dormant stem cells are on, and it's turning on your glutathione. If your original glutathione level said that your level has to be 555% higher than what it is today, guess what? It's going to get reset to that. Whatever your custom order called for, that playbook is now in order. So 12 hours you're wearing this glutathione patch, you match those 12 hours with the rest, repair, and restore cycle. And in 24 hours, your glutathione levels are going to be anywhere from 300 to 600%. And we know that because we've measured that and it's in our studies. And we know that from other people who also get routine blood tests. So this is a very powerful thing to know. The other thing I want to mention about people with neurological conditions, especially since we are in a day and age where we are all technocentric, we're all focusing on our technology. I love the fact that we're doing this particular interview and we're doing it using technology. We have a blue light lit screen, which does have an effect on our neurology. And most are not aware. We are aware of the proliferation of neurological conditions, of autoimmune situations that have been going on, people with chronic inflammatory conditions. We're starting to see things in 30-year-olds and under that we didn't used to see until people were like in their 60s, 70s, and 80s. And a lot of it has to do with the technocentric lifestyle that we now live in this modern age. And some people have a greater sensitivity than others, but we're all affected by it. So the amount of blue light that we get from computers, laptops, notebooks, iPads, Kindles, not to mention, I mean, those are the obvious ones. The not so obvious ones are the light sources in your house. What lighting fixtures you have in your living room, bathroom, kitchen, bedroom, etc. For most Americans, we have LED lights. They're either LED lights, they're halogen lights, or they're fluorescent lights. 100% of the places out in public, hospitals, churches, stores, your car, for the love of Pete, let alone a plane, all have LED lights. So what's the problem with this LED lights? Well, the problem is it causes blue light toxicity. Well, why would anybody care about blue light toxicity? Let me tell you, you should care, because blue light toxicity causes mitochondrial dysregulation, which is just a mouthful to say that at a cellular level, the little tiny factories that process and digest your energy to send the proper electrons and nutrients throughout your body are getting all whacked. And because they're getting all whacked, you have this cascading problem of massive inflammation going on in your body. And that's part of the domino effect where we see people, everything from a lot of the different neurological conditions to autoimmune disorders to even weight issues, believe it or not. Someone who is overweight is just not someone who overeats necessarily all the time. There's someone that their chemistry is so out of whack that their ratio of protons to electrons is way off base. There are more protons than electrons. Someone who doesn't have a weight issue has a balance of less protons than electrons.
My goodness, that's incredible. I know that if everyone didn't have their mics off, which we've asked them to do, they would all be like stunned that it is the imbalance. I'm going to repeat, make sure I got it. The imbalance between protons and electrons that is actually a factor in overweight, not necessarily just what we think of in how much food, what food, how much exercise, etc. Lillian, that's amazing.
It all starts with chemistry, and we only have one little piece of the brain that's not actually inside the cranium, and that is the retina. We've got an optic nerve in the back of our eye. And that is the one piece of brain that we need to have it exposed. Instead of having this disbalance of having blue light coming through our eye all the time, we need to expose it to the infrared light that we have in our body via the sunlight. And so just getting out in morning sun after sunrise, before 10 a.m. in the morning, you do that and you're wearing these stem cell activation patches, and my friends and gems, you will notice a quantum massive effect on your health and well-being, provided that you're drinking 50% your fluid weight and ounces of water every day, right? That is paramount, because our body proteins that aren't hydrated don't work. And if you look at a DNA strand, water is really the building block of the body. It's the structure that holds everything up. And so when you look at a DNA strand, it's 92% water. So when you a normal human being, a baby is like 82% water because it's nice and juicy coming out of the mother's womb. Someone over 60 is about 55%, water. So when you have a DNA strand and you start to, first of all, look at it, it's 92% water. When you feel 2% dehydration in your mouth, that means when you start to feel thirst, you have 2% dehydration. When you have 8% dehydration, the DNA strands actually start to unravel, which is kind of scary if you think about it. If you get to 10%, you lose your mind. You literally lose your mind. You start with different neurological conditions and memory loss symptoms. And if you hit 12%, that's it. You don't make it. That you're dead. Your body shuts down at 12%.
So let's go, because we're so short for time, let's go into your strategies for traumatic brain injuries. So, because we're talking about the brain now.
Okay.
Tell us that. And we don't have much time left in the show, so we may not get to every question. Yes.
Okay. So my strategy, I have something, we call it a veritas concilium, and that's simply veritas means true in Latin, and concilium is a plan of action. So we have a true plan of action, a veritas concilium, that if you have a traumatic brain injury, I'd like to keep the patches close to the brain. My first starting point is always governing vessel 14. And after the first, depending on the person and the parent, depending on the severity of the condition and how they're presenting certain symptoms, we will circle them around the head. So for example, one of the protocols that it's not a protocol, it's a veritas concilium. One of the strategies that we like to employ is we'll put, for example, an X39 on the left temple, an X49 on the right temple, a glutathione under the left ear, a carnosine under
Wait, a little bit slowly because we have to take notes, all of us.
Okay.
X39 on the left temple,
Left
X49 on the
right temple. Then we have glutathione right under your left earlobe. It's almost like touching your carotid artery. In fact, it is touching your carotid artery. There's an acupuncture point there. So you're going to put that's actually very close to the brain, which is why it's methodically put there. So glutathione would be under your left earlobe, and right under your right earlobe, you're going to put carnosine. And then you're going to put your Eon patch either on your governing vessel 14 or right at your hairline, below the hairline. There's an acupuncture point. I believe it's governing vessel 18. You'll put it right below the hairline at the top there. So basically, you can see that you're kind of encircling the brain. And that is what I have found, that's a great patch placement for people that are suffering from multiple concussions. We call it multiple concussive events or traumatic brain injuries.
Now,
even anything having to do with the eyes, that's a very effective.
One quick question. So I believe you're saying all at the same time for the same 12 hours.
Yes.
But they have 24 hours. So is there something else you want them to use during the other 12 hours for this?
So what I do is, I do split up patches like between daytime and nighttime. I'm a big proponent of the Alavita patch and the carnosine patch at night.
Okay, good.
So for example, the patch placement for Alavita on your third eye, and then your carnosine patch on your right temple. And I've experimented with myself. When I first started, I did on my third eye and the right temple. And I've even tried putting 2 carnosine patches. I don't notice a significant difference with the right and the left. I know that if I were to scan myself, I would see probably marked improvements, but I know that it is beneficial because the thin skin that you have on your right temple and your left temple, that's practically touching your brain. And all effect, there's very, very thin skin there, and your nerves that are on that part of the brain. It's an effective acupuncture point to put those patches. What I have found for myself and many others is that if you didn't have vivid dreams before, you'll have vivid dreams after you do this. In my case, I had vivid dreams before. The biggest difference that I noticed is that sometimes I would dream 2-3 times in a night. And when I would wake up, I remembered all 3 of the dreams. And even days and weeks later, I still Like I have a dream that I had like two nights ago, and I'm still thinking about how cool the house that I was in and what I saw and what it was meaning and what significance, because dreams are your subconscious mind is trying to give you information. So please make sure that whatever dreams you're having, you're not just going, oh, that was cool, and ignore them. That is your body's communication device. So there
Write
is,
them down.
yeah, there is a whole lot more. We could do a show just on all that aspect, but just know that
Good. I'd like to, because I teach lucid dreaming. That's one of the things I teach my coaching clients. And I love what the patches do for people who are, and thank you for Charlene, who is right there, and I'm looking at her today. Yeah, because all of these patches have these wonderful extra benefits. Okay, but back to today's show. So you spoke about the effect of the mother's brainwave state on the baby.
So yeah, this is another really big deal. And I figured this out when my son was 11 years old. He almost died of Guillain-Barré, which is a disorder where your immune system, your peripheral nervous system turns on your immune system turns on your peripheral nervous system, and it presents as a paralysis that starts with your feet and it travels up. And many people pass away from Guillain-Barré when the paralysis reaches your diaphragm and your lungs because you go into respiratory arrest. If they catch it in time, they can put you on a ventilator and a respirator, but sometimes they don't catch it in time. So in his particular case, he was then paralyzed from the neck down. And what I've always been very spiritual and very intuitively led, and already had quite a bit of background in health and wellness and medical procedures and so forth. And so one of the things that I realized, and God bless my father, because when I was in high school, I'll never forget that he gave me a book, and he's still to this day, he's really big into positive mental attitudes and metaphysics and all that. And so he gave me a book by Dr. Norman Vincent Peale called You Can't Afford the Luxury of a Negative Thought. And the first day that we are in the ER, so now instead of being on the working side, I'm on the front side bringing my kid in as a patient, which is a different experience. And so as we were waiting for his brain to be scanned, we did not know why. He went from doing black diamond runs up in Northern California on a ski trip to he lost his gross motor skills, which is, walking, talking, moving, to not being able to turn on his spin brush, which is what signaled to me that something was seriously wrong. And that's how we ended up in the ER. So as we were waiting for the scanner, we were going to have an MRI of his brain done. I remember thinking, I can't afford the luxury. I just remember seeing the cover of the book, and you can't afford the luxury of a negative thought. And that kept on going like a scroll in my head. And over that week in PICU, he ended up spending 11 weeks in pediatric intensive care, and we almost lost him the first week. But what I became very acutely, it was like laser-like focus, was that I cannot afford the luxury of the negative thought. If I have doubt, if I'm freaking out, if I'm worried, if I'm putting any kind of energy that is something other than love and hopeful, it's going to bring him down, because he knows, or he thinks, that I know more than him. And if I'm freaking out and worried, then he should be freaked out and worried. And so I also knew enough from studying the human brain and the body that the mother's autonomic nervous system is entrained with the son, with the child's.
Let me just add one thing, because it's very urgent that people do not misunderstand what Dame Lillian Walker just said. She did not say that no matter what wackadoodle idea you have, that you don't allow a negative thought. She is a brilliant scientific mind, this wonderful guest of ours. She is brilliant. She knows what the facts are. She knows what the science is. It is not about getting rid of all negative thought and not doing your research. I want to be so clear here, because Lillian, you've had people that you've worked with. I've had people I've worked with, and they have an idea that something is going to be a plan, but they really need a lot more information. So please continue, because that's how your dad was able, and your son was able to get the care they had from you.
Yeah. Yeah. And so, and I was no stranger to having negative diagnostic tests. It could be anything from a ultrasound to a PET scan to you name it. I knew what it was like to get a test result with unwanted results, but to stay as an observer and as the doctor, as the expert or the specialist left with that information. Now, you know, it's in my field of awareness, the way my mind, how I manage that, because you do have to have a managing strategy. So with him, that information left, I'm aware of it. I'm not dwelling on it. I'm not going, oh my gosh, what am I going to do? I'm not a chicken with a head cut off, like freaking out, because nothing happens. That just feels awful to be like diskiltered. And so you hit the pause button, you listen to the negative information, the unwanted. And so as the pediatric neurologist, in this case, the head of pediatric neurology at Children's Hospital, would come back with results to us, we're like, this is not the results that we wanted. And of course, probably the more difficult part, I think, for us humans is when we have other people who are loved ones around us who start crying and weeping, and they're nervous, and they're, you know, because it's hard to see a loved one in pain and in a terrible predicament.
And but also, let's remember that the key to all of the solutions is to learning how to manage your mind, which is another thing I teach. You know, you've got to be able to manage your mind. You've got to be able to self-soothe. You're not going to be able to listen to information that triggers PTSD or fear or confusion and take proper action if you go into panic. So that's exactly what Lillian's describing.
Yeah, so it is a choice. You can choose, like, so when we had that outcome with my son 4 months before, I had the evidence. My then husband, my husband's co-worker, 4 months before, he had been diagnosed with Guillain-Barré. He was 46 and he died of Guillain-Barré. So the reality of how grave the potential was clear in front of me. Did I dwell on that? No. I decided, no, there's got to be a better way. This is happening for a reason. Our setbacks, I know, are our setups. No experience is wasted. I don't have the answers to all of it, but I know that if I tune in and I stay centered and I just stay as the awareness, first of all, I had to be selfless enough to not dwell in my feeling state, because I couldn't afford, if I had a negative thought, then I was going to feel bad. And then that was just going to bring my son was already fighting for his life. So the key lesson that I want to impart with women and with fathers too, but especially with women, is that your children, doesn't matter if it's a baby, doesn't matter if it's a teenager, doesn't matter if it's a grown adult, your autonomic nervous system, which is housed through your spinal fluid, through your, basically from your brain, goes down your brainstem into your spinal column. So that's where your autonomic nervous system is housed. That entrains with your child's, and distance doesn't make a difference, which is how sometimes mothers, their son could be in Afghanistan in the war and they know that they were injured, even though they haven't received a phone call or anything. It's because of that entrainment. That entrainment is very powerful. What's interesting is I never had a doctor, never had a nurse, never had any scientist. I never had anyone specifically teach me how powerful and how we could actually use that. It was through my experience that I realized I was like unconsciously competent, if you will, that because I couldn't afford a luxury of a negative thought, that I had the power to hold him up when he couldn't hold himself up. I had to hold us both up. Now, fast forward.
The more skilled person always does. Now, we want to make sure we have enough time to talk about two remarkable results you've had with cancer, which is everyone's least favorite word, right? So if you talk about stage 4 and metastasis, if you talk about brain tumor and the amazing results with regard only today to Lifewave.
Okay.
Yes.
So when it comes to cancer, any kind of diagnosis that you get that's unwanted, that same resolve where you're just choosing, it's like, okay, you know that this is happening for a reason. That's the first thing. That's why these stem cell activation patches do come into your experience. It's because you've made a choice to not allow it to get infinitely worse. You've chosen to turn your boat around and to make things go infinitely better. And this is the vehicle. You're literally bringing the light back in. We can talk about so many different levels that you're doing that in, but it's really redirecting the infrared light that you have already in you and redirecting it back inward to affect this outcome. So I had one gentleman, so some of the first few people I had that I put the patches on, in fact, the first half dozen people I had all had some various forms of cancer. The first two had stage 4. One was a female, one was a male. So let's start with the male. The gentleman that I put the patches on in Friday, August 26th, his daughter calls me up frantically. Her name is Sunday. And she's like, oh my gosh, my dad is on his way to the ER. He's hemorrhaging, he's urinating and defecating blood. He has horrible stomach pains. We have no idea what's going on. And I said, oh my gosh, we need to patch him. And she had just ordered the patches herself. And just the night before had received her patches, had not even opened the package. And so she told me, she goes, I just got my patches. Oh my gosh, I haven't even had a chance to call you to tell you I've been so busy. What do I do? And I said, can you meet your father at the emergency room? And at 7 o'clock sharp, we'll get on a Zoom call, we'll do patch placement. So we went ahead, we started to put the patches on Thene. I used to work in the emergency room like 30 years ago. So I knew what the protocol was going to be, what their triage and what they do when they first bring him in. I knew he was going to be admitted and so forth. So long story short, 2 days later, he was admitted. He was not just admitted, but he was admitted that evening into the hospital. But 2 days later, he was diagnosed with stage 4 lymphoma cancer.
And where did you put the patches was what everybody wants to know.
So everybody wants to
hear, right?
So he had stage 4 lymphoma cancer in the stomach. And he had several other in his colon and duodenum and so forth. But the big one was in his stomach. And he also had it in his bones. So it was stage 4, it was more advanced. So, the brain controls everything. And he had this spreading thing that was in his bones, which is basically your exoskeletal muscle structure, holding up structure. And so we just put it on governing vessel 14. The entire time he wore it, all 5 in a row. We just put X39, X49, glutathione, carnosine, and eon. We kiss them together. The white circles never overlap. The adhesive overlaps, but the white circles don't touch because we want to maintain the integrity of that signal. And we just put it from the top of that neck bump all the way down the spine. So to this day, he still wears the patches. It'll be a year, August 26th, 2023.
And it's your Fantastic 5 you're talking about.
That's the Fantastic 5. At a later point, after the PET scans showed that his cancer disappeared, then he added energy enhancer and so forth, but he actually didn't need the energy enhancer out the gate, believe it or not.
Just to be clear, the Fantastic 5, just as you've described it, the X39 at the top, I believe.
Yes.
And tell them so that they get all the data, they don't miss any info.
Lillian. Yeah. 39, 49, then glutathione, carnosine, eon. And I tell people to always do things in the same order. That way you don't get confused. That way you don't miss anything. Even if you change location of a patch, but if you always do it in order, then just things are, you have better results, in short.
So for that person, that guy, you didn't have him put the patches where the actual challenge was. You didn't have him patch his stomach, patches, et cetera, et cetera. You put it all on his spine.
No. So I'm a big proponent of listening to my intuition and my inner voice, so to speak. And so my gut said, it's got to be on the brainstem. My left brain wanted to put it obviously on the stomach, like put all of them on the stomach. But I'm like, no, he needs to have it on the brainstem. So we honored that. We put that on his brainstem on the governing vessel 14.
But for another person, it might have guided you to do something different.
Yeah.
So we're only speaking to our audience today.
Yeah.
Not just about this man, because the audience wants to know, well, if they have this situation or if they have a friend or family member. So it's very important to know that Lillian was looking at her own inner knowing.
Yes.
Which either you're in touch with yourself or not yet. It's a process of learning. I teach people this all the time, and Lillian does as well. And so here you have two options. She said today, it was the brainstem. So it was 5 in a row from the, governing vessel 14 down. Another person, another situation, she might have advised them to put all 5 somewhere else on their body. So just keep that in mind.
Yeah, I mean, I think if we would have, we don't know because time has already passed and we can't go rewrite history, but I'm sure he probably would have done just as well if I would have taken for the first day and just taken all 5 patches either in a row on the stomach or in a circle around either below his belly button or above. It probably would have worked fine as well. I know that we got his bleeding and his pain zeroed out in the first 24 hours.
Yeah.
So obviously it was the right call to put it on the brainstem. Again, that's like the master control, which is why it's such a powerful acupuncture point. So the bottom line is,
and you also worked with someone very successfully who was suffering with a brain tumor. So
Yeah,
what was your idea, solution, plan for that?
yeah, so I had people with brain tumors. I had someone with a calcified parasite in between his pituitary and his pineal gland that was inoperable, who was having seizures, and it was inoperable. The doctor told him, and he was also disabled at the time, and he also was HIV positive. So we had a lot of things kind of going on at the same time. We started him July 23rd of last year. And with him, again, because it had to do with the brain, he also had other things going on, but his big one was that calcified parasite in the middle of his head. And long story short, we put those also on governing vessel 14. With him, I never varied moving him anywhere else in the body. In December, just 6 months after having him on the patches. Now, bear in mind, he's been having blood tests done every 90 days since 1998, because in 1998, he was diagnosed with HIV, he was HIV positive. So this man had a lot of complications in his blood, even though he's in his early 50s. So fast forward to getting on the patches in July. In December, he had his first blood test. First of all, his seizures were gone. His energy level was up. His sleep was fantastic. His stamina is super. He's just feeling fantastic in the first 30, 60. It's he's just like joy, joy, joy. In December, he's like, wow. His blood test, it's like, there's no evidence, no trace of HIV positive anywhere in his blood. First time that ever happens. Fast forward to June of last month, because we're now in August. And in June, just 30 days ago, he had another blood test. So I think he's got either 3 or 4 now that all show no presence of HIV. But his whole brain situation, that got resolved in the first not even 6 months, where at the end of last year, he got a new job, he's making 5 times the income that he did before. He's traveling all over the country because he works for an oil company. So he basically he did a 180 from being disabled to completely enabled, and he's traveling. He is free from the chains of pain. He's living his fullest and best life. And that last call, it was a 50-year-old man's voice, but it felt like a little boy that couldn't stop laughing and giggling, and how he's so happy, so excited, and how his friends are in so much awe of.
It's thrilling.
Yeah,
it's
really is thrilling.
Wow. Now let's talk about premature births, preterm issues. I know that is a very important topic for you.
Yeah, so premature births, this is something that's near and dear to my heart as well. Neurological conditions are because of not only my son's experience, but then I became a neurological patient as well. But let's talk about premature births. So I had 3 preterm babies. All 3 of them were born at 33 weeks. So they're all 2 months early. So I'm very, very familiar with all the nuances having to do with preterm births. And since then, I've met quite a few. It's amazing how common, and it's actually more pervasive now than it was when I was pregnant. But the whole situation with, there's a whole different series of reasons why people have premature births. Some of them are biochemical, some of them are structural. Like in my case, mine was a structural issue, which I did not discover till my oldest son was born. So it depends on what your structure is like, but also your chemistry. But a lot of what we see today it's biochemical. It has to do with your biochemical response to environmental factors, the blue light being one. It's not just the blue light, it's also the electromagnetic frequency that you're getting from these devices. So one big thing for men and women, so it's not just a woman thing, it's also a man thing, because just holding your laptop on your lap and working from your laptop on your lap, that electromagnetic frequency is altering the rate at which you cycle on your ovaries and your uterus. So it is disrupting your estrogen, your progesterone, your prostaglandins, your testosterone. It's throwing all of your chemistry off, and it's pulling all sorts of things that shouldn't be pulled inside of your body. For men, it's also throwing off their testosterone levels. It's wreaking havoc, which is why we're seeing younger and younger men coming down with prostate issues. It used to be, something for men 55 plus. We're seeing guys that are in their late 20s and early 30s now having prostate issues. And it's like, what? But it's technology. And so we're not saying not to use a technology, just be wise with how you use technology. So don't put your laptop directly on your body, just like your cell phone. You don't put it directly on your body. You want to have some sort of barrier in between. There are things like the Iris program that you can put on your laptops and so forth, so that you don't get the full blue spectrum light and you have a balance, because it's affecting your eyes. And we think of the eyes as just being a camera, but the eye is actually a circadian rhythm clock, which sets all the timing for all the organ systems in the body, which is why it's so important to get out in natural sunlight and get that light from the morning, that you can only get the benefit of UVA and UVB light right from sunrise until 10 o'clock in the morning. You only need like 10, 15, 20 minutes. If you can do longer, great. But just 10 minutes automatically increases your pulse ox, and it sets your UVA light, sets your vitamin A, and the UVB sets the vitamin D in your blood in a way that no supplement can help your body. So for starters, people who have any kind of fertility issues, the whole preterm birth, if you have an east facing window in your house that you can sit in the morning sun so that you're getting, more than 30 minutes worth of sun, because it affects your liver, your bilirubin, all sorts of different things. That's kind of a bigger discussion, but know that wearing the stem cell activation patches, I've had women who had stopped menstruating who have restarted menstruating. I'm not guaranteeing that that's going to happen for you, but I've seen it. I've had women who have had irregularities in their cycles for the first time ever. They became regular. And so we can unring the bell of whatever damage, whatever it is that caused that dysregulation that's presenting as the symptom that you're experiencing right now. You can unring the bell now. You ring a bell, you hear the sound, you can't bring it back. But in this case, this is one of the few do-overs in life that you're going to get.
Beautiful. Well, thank you so, so much, Dame Lillian Walker, an amazing, amazing fountain of information and knowledge. Incredible. Thank you so much for being our guest.
You're
And
welcome.
I want to remind everybody, if you don't yet know about Lifewave products, please contact your friend who told you about this show. If you want more information, if you want the sheets that describe the comparison between the X39 and the X49, the 14 pain relief solutions I've discovered by talking to all of you, my own localized patching system.
Or plan of action.
Exactly. And also, let me remind you, this is our 46th show. There are 45 shows already on my YouTube channel, which is youtube.com/Susan Allan 2001, and that's ALLAN. And if you're emailing me with a request, please be specific and let me know what you'd like me to send you back. And it is susan@susanallan.org, ALLAN. And our next show, as always, the second Thursday of the month, is going to be in September. And I am so grateful, Lillian, for having you. Just really fabulous.
Thank you. Thank you for having me, Susan. It's been a joy.
Beautiful. Thanks everybody for watching, and the show will be live, recorded on the YouTube channel in about 10 days. And if you're already on my email list, you will get a notice. If you're on Dame Lillian Walker's email list, she will let you know. So have a fabulous, fabulous rest of your day. Bye-bye.